Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Does obesity have an effect on fertility? Let's look at that. Obesity disrupts hormonal imbalance in several ways, which can ultimately lead to infertility in both men and women. These disruptions affect various hormonal systems in the body, including those involved in reproduction. Let's see how it can affect fertility. First is insulin resistance and hyperinsulinemia. Obesity often leads to insulin resistance where the body cells don't respond properly to insulin. In response, the pancreas produces more insulin to compensate. Now, these elevated insulin levels can disrupt the regulation of some hormones like estrogen, testosterone. They can stimulate the ovaries to produce excess androgens, which are male hormones actually. This can lead to conditions like polycystic ovarian syndrome, also called as PCOS in women. It can lead to irregular menstrual cycles, anovulation, which is lack of release of egg, and reduced ovarian function, which can cause infertility in women. Next is increased estrogen levels. Now, if you are obese, this can also be an issue. Fat cells, or also called as adipose tissue, can produce estrogen through a process called as aromatization. In obesity, excess adipose tissue can lead to higher estrogen levels. These elevated estrogen levels can disrupt hormonal balance in men and women. They can cause menstrual irregularities, including heavy or irregular periods in women. They can also contribute to endometrial overgrowth, which is also called as hyperplasia, means the thickness is too much. It increases the risk of conditions like endometrial cancer. It can also impact sperm production and function in men. Another problem with obesity is leptin resistance. Now, leptin is a hormone produced by fat cells that play a role in regulating appetite and metabolism. In obesity, the body can become resistant to leptin signals. This resistance can lead to the disruption of normal regulation of reproductive hormones, leading to irregular menstrual cycles in women. It can also contribute to hypothalamic dysfunction, which can disrupt ovulation. The next problem is reduced sex hormone binding globulin. It is called as SHBG. Now, obesity is associated with lower levels of this hormone, sex hormone binding globulin. It is a protein that binds to sex hormones like testosterone and estradiol. Now, reduced SHBG can result in higher levels of free biologically active sex hormones, which can disrupt hormonal imbalance. So, this is not a very good effect of obesity. Inflammation. Obesity is characterized by chronic low-grade inflammation. This inflammation can interfere with hormonal signaling pathways, impact the function of hypothalamus pituitary gonadal axis, which controls reproductive hormones. It can also promote insulin resistance and disrupt ovarian function. The next problem is hypothalamic pituitary dysfunction. Obesity can affect the hypothalamus pituitary axis, which is essential for regulation of reproductive hormones. Changes in this axis can result in irregular ovulation and menstrual cycles. It can also cause altered adipokine production. Adipose tissue secrete various hormones and cytokines known as adipokines. Changes in adipokine production can affect hormonal regulation, including reproductive hormones. Endocrine disruptors are also caused because of obesity. Obese individuals may have higher levels of environmental endocrine disrupting chemicals. They are called as EDCs. They are stored in adipose tissue. These EDCs can interfere with hormonal balance and reproductive function. Now, these hormonal imbalances and disruptions can lead to issues like PCOS in women, reduced sperm quality in men, contributing to infertility. Addressing obesity through weight management, lifestyle changes, medical interventions can help restore hormonal balance and improve fertility outcomes. You must seek good guidance from healthcare professionals like endocrinologists, reproductive specialists who can give you critical information about how obesity can result in infertility and what you can do to bring down your weight. If you wish to understand more about this, please feel free to call us on the numbers that are displayed on the screen. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.